When the very systems we work in don't promote self-care, how can we genuinely create happy healthcare communities?
But one of the nurses was telling me that she had just done a 12-hour shift. Then they asked her to do an 8-hour shift after, which she said yes to. And then they wanted her to turn around and do an early. And I said to her, where's the fatigue management in this? But I said to her, if you make a drug error, whose fault will it be? And she said, it'd be mine. I said, would the hospital support you? She said, probably not.
If you're loving these episodes, don't forget to click follow and subscribe. And follow us on Instagram for all the behind the scenes fun.
We care for the land and sea.
So today we're joined by Bek Woodbine, host of Tenderness for Nurses podcast and founder of Perfectly Smooth, Brisbane's premier medical beauty clinic. Beck is a passionate advocate for nurse self-care and fostering a culture of compassion among healthcare workers. In her own podcast, Beck creates a safe space for her guests to share their own journey, and today we feel so lucky to have her here to share her journey with us. Welcome, Beck, to It Takes Heart.
Thank you so much for inviting me. I'm actually very excited to be on the other side of the microphone today, albeit a little bit nervous because it's just a little bit different when you're not in this, driving seat. So
it makes us feel better because we've been terrified about today. We've been so nervous, and because we've had to keep moving it. I'd had the shingles, and I think you lost your voice one time as well. So it's been pushing it down. But
appreciate you coming in.
But it's the right timing. So
yes, today is when it was meant to be. We'll have our best conversation.
Definitely. So we'd love to start with your podcast. I know that I discovered your podcast before us doing this, and what led you to start? I know that you talked about, rock bottom brought you to the podcast in one of those first episodes. Can you talk to us a little bit about that?
I had wanted to do a podcast for a long time, and I thought initially it would be more about the aesthetic space, but there's so many podcasts out there about that, and to be quite honest, it's really boring. So I'd had my own journey with stopping drinking, with burnout, getting to the stage where I didn't want to go into work, had to take a year off work, but run the business from behind, which had its own challenges. And I'm someone that says if I'm going to do something, I do it. And I actually spoke to a friend of mine, Katie Matten, who was also, they own Podshape.
Yeah.
And she said, just do it, Beck, just do it. And so I did. I just got in touch with a whole heap of friends, colleagues, people that I knew would have really interesting stories. And they all said yes. They all came
had the
in.
network.
I had the network. And I have had some, and it gives me goosebumps, remarkable. They've all been remarkable. But there are some that have shared such intimate, beautiful details of themselves. And, my listeners get to hear that, and the response has been so many people come back and go, oh my God, that is exactly how I felt, or you helped me navigate through a really rough time, or the interesting thing is probably the number of people that reach out to me now about stopping drinking. That's huge.
So can you talk a little, because again, you're the host and interviewing all of these people, and you're again sharing their stories, to talk about you and your own personal experience. What is it? What did that look like for you? Because we've done a lot of episodes now, we're talking a lot about burnout and a lot of people feeling it, and it's more prevalent than ever. What did that look like for you to bring you to that stopping point?
I had no boundaries. I said yes to everybody.
Was that in work and personally as well?
Both.
Yeah.
More work. I
and
couldn't say no to patients.
Clinic. It wasn't when you were hospital nursing. It was
But even hospital nursing, I would be that person that they would ask to do overtime because I'd always say yes. I got to the stage, and I remember this beautiful client came in, and I started to develop horrendous anxiety, terrible anxiety. And she came in, and this one day I couldn't stop shaking and I couldn't inject her. And it wasn't from anything other than I was so anxious, and I couldn't even tell you why I was anxious.
It wasn't like anything was happening that day.
No, but it's like everything in life, nothing just sort of happens on its own. There were quite a few things that were happening all at once, and it just got to the point I couldn't cope with it all. And it was at that point, you know, I sort of stepped away, took some time out. It has taken a long time to work through burnout and anxiety, and I do see a psychiatrist because my anxiety was so bad, and actually I was diagnosed with depression and anxiety. So then I started treatments for that, and I'm being a different person. It's something I have to work on all the time.
And how did that feel to get that diagnosis?
Being a healthcare worker particularly too.
It was actually very confronting, very confronting. And the treatment I had, I'd never even heard of it, TMS, which is transcranial magnetic sequencing. But it changed my life. And interestingly, there's a laser company that's bringing out a lower level of TMS into the wellness space, of which I am highly opposed to, because I have to, when you have those sort of treatments, you know, I'm under the care of a psychiatrist.
I was going to say, talk us through what is
TMS. So TMS, you have to have a threshold testing. So it's like a big magnet sits on your head and it sends pulses down into your brain. So left side's depression, right side is anxiety. I think both are PTSD, and pain is your M1, which sits along the top of your head. And actually my pain specialist, because I have recently had back surgery, he's looking at getting a TMS machine for pain. It does make, and it has improved my pain since going back and having some TMS again. But what it does is if you can have seizures with it. So usually it is done under the care of a registered nurse under the supervision of a psychiatrist. Prior to COVID, you had to go in to hospital to have it done. But now they're setting up clinics. And now one of the laser companies is out there promoting it, and Gwyneth Paltrow just put something up on her website or Instagram about trying it. And I just see...
That's so irresponsible, isn't it?
It's so irresponsible, and, you know, people, you can't be taking drugs. There's certain drugs you can't be on. You can't be using recreational drugs when you have these treatments. You know, someone who may be misdiagnosed or undiagnosed might go and try and have those treatments and think it's going to help, and it doesn't.
And is there earlier things you can do before you get to that treatment too? Or is it sometimes just it's best suited for certain people?
I think mine by that stage was so bad that was the choice.
Yes, so it's
by
not
the
like
psychiatrist.
when you were talking about the wellness of just anyone can just, let's go and do that.
Well, look, she was promoting it for perimenopause.
Yeah.
I mean, everyone's promoting everything for menopause and perimenopause. It's sort of the it thing at the moment.
Yeah.
It changed my life, and it saved me. There's no doubt about that. It just concerns me that it's going to be another thing in the wellness space that really shouldn't be touted as something that's just for wellness, when, you know, it's going to be double the price of what the machine is that's in my psychiatrist's office. Nowhere near as effective. And I just see it, you know, hitting vulnerable people. Vulnerable people are going to be the ones that are using this. And once again, the aesthetic industry is targeting vulnerable people.
You said a little bit earlier there that you now have to work on, you know, you're managing burnout every single day.
Yeah.
What does that look like? And one other question was, in the lead up to that moment where you just couldn't inject, was there little micro signs that on reflection you...
Oh, absolutely.
What were those signs, and what does it look like every day now for you to keep on top of it?
So to keep on top of it, I've limited my injecting hours. It doesn't mean that I'm not involved in the business full time, but I'm not having that constant face to face. I have got a really good team around me, and they probably manage me better because I still have that tendency to add people on and try and, you know, please everybody.
People please, yeah.
And a lot of nurses are people pleasers. I mean, that's why we do what we do. You know, we're carers.
It's very hard. Like you said, you can't say no. Overtime, would you work? Yes, I want to. Yeah.
And interestingly, when I was in hospital recently, you know, after having surgery, one of the nurses came in and, you know, they were fantastic at Brisbane Private, and, you know, thanks guys, you were wonderful. But one of the nurses was telling me that she had just done a 12-hour shift. Then they asked her to do an 8-hour shift after, which she said yes to. And then they wanted her to turn around and do an early. And I said to her, where's the fatigue management in this? And yes, they do get paid well for that. But I said to her, if you make a drug error, whose fault will it be? And she said, it'd be mine. I said, would the hospital support you? She said, probably not. I said, so why are you taking on these extra shifts?
But equally, why are they putting the
Why are they
staff
asking
in
the
that?
question
Where's
in
the
the first
leadership
place?
in all of that as well?
Exactly. And that then goes back to the point that there's not enough nurses. We can't retain nurses because, you know, we're treated still so badly.
Self-care for nurses then. How can we better support the nursing community, and particularly when you've got leaders asking them to do more shifts and, you know, fatigue management, there's so much systemically that they've got to deal with. What would you like to see, or how do you think we can better support them?
I think we need to change the way we think. Over and over again, I'm still hearing from nurses that we eat our own. That has to change.
What does that mean, we eat our own?
So if a nurse is doing well or they want to go places, and this has really happened with my colleagues as nurse practitioners, it's such an odd space to be in because there's a lot of nurses that don't like us, a lot of GPs don't like us, specialists love us, because we're that highest clinical level. A lot of us are going out and setting up our own businesses and working independently. So GPs and medicine find that threatening, except, of course, specialists who are at the top of the ladder. Other nurses don't like it either because they're not willing to put the time and effort in to study. And it is a really, really hard master's course to do. You know,
If the nurses don't see it as more support, so, you know,
I don't
to
think
see
so.
that
It's a tall poppy syndrome in nursing. And historically, you know, if you were really good at something, or, you know, for example, when I worked in a day surgery centre, I used to love suturing. And I would ask the doctors to teach me how to suture the patients. Now, look, it was just, you know, some ports for laparoscopies and things like that. But the team around me had a crack at me and they just said, oh, you just want to be a doctor. I never sutured again after that. Because they saw me working outside or thinking I was something I wasn't. And that happens all the time. Instead of supporting each other and just going, oh my God, you're a fantastic leader. Let's work with you to become a leader in this space.
Yeah, lean into your superpower.
I guess that's not just healthcare, is it? That's just
I think that's across the board. I think that's very Australian, you know, tall poppy syndrome that we all talk about. You certainly don't get this in the States. When I go to the States and go to the conferences and catch up with my colleagues over there, they love anyone that is doing great. They love anyone that is making money. They love people that are going to stand up on stage. And in fact, nurses are boycotting any conferences, anything like that, if there are no nurses speaking now.
That's really good to see, because that's it too, hearing from each other. But how can we change that here if the States is leading the way but we're not? Is there some really like low-lying fruit that we could, you know, grab onto to make some change?
I think this younger generation that are coming through, they're not going to put up with this.
No. I was thinking that when you were speaking too, I was like, surely that generation, if nothing else, is going to start to change.
who have big dreams and they really do want.
They do.
Yeah.
However, all of, you know, what do they say? They're going to have 7 different careers in their lifetime.
Yes.
However, in nursing, you can have 7 different careers. You can do theatre, you can do ER, you can do rural and remote. You can do overseas, you know, Red Cross work. There is so much you can do in nursing that just opens up to you if you want to. I mean, in my career, I've done children's, I've done workplace health and safety, I've done palliative care, I've done theatre, I've done aesthetics, and I've done dermatology. And throw in that a few, like recovery, theatre, and anaesthetics. You know, like I have had a remarkable nursing career. Remarkable. The things I have done. And I loved segueing, and I've always loved working independently, and I think that's a difference as well.
Do you think that people are encouraged to branch out from what they're doing, or people preferring them to stay in the lane and stay here? Because we've certainly noticed that, nursing graduates coming out, they maybe not know of the opportunities that are available to them, that they could actually do all of these different fields and different locations around Australia, and there's
But that's
so
what
much
I say
opportunity.
to them. I just say, get onto a program, a graduate program. Try and work in as many places as you can. Do high dependency, do ward work, do medical, do rehab, do whatever, and try different things, because you will find your passion. And once you become a nurse practitioner, we do specialise.
Mm-hmm.
Even though my nurse practitioner was in primary health care, I have specialised in dermatology and cosmetic dermatology, so aesthetics.
And what drew you to that? Because you had a vast career in all those areas, and you could have done your masters and I guess become that nurse practitioner.
I bought a little spray tan business.
Did you?
Just to make some moolah on the side.
Was that when spray tanning was like a new...
Absolutely.
Like when they were doing it in the garage, in the tents and, yeah.
Everyone was orange. There was
Yeah,
only
yeah.
one. There was sun effects. That was
100%,
it.
yeah.
And everyone pooh-poohed me. And then I started doing
Why
it.
did they poo-poo you?
Oh, because, I was doing something different.
Yeah.
And making money.
And making money.
having-
And we did.
yeah.
I did very well from that little business. But then I thought, here I am doing this, and I really could be doing skin. And I'd always loved skin. I mean, God, my mum bought me a Yardley skincare pack when I was in grade 7.
Yeah.
I've looked after my skin.
Yeah.
I have always been interested in skin, and I thought, this is nuts. So I put together a business plan and bought a laser machine. And then it was all self-taught because there was no courses around. And then my business grew and grew and grew. And then the number of people that were asking me to inject, and I didn't want to. I wasn't really interested in going down that pathway.
And why was that?
Didn't interest me like skin.
Yeah.
And I love my lasers. I love
what was
the
the
devices.
lasers doing? Was that...
Like skin, hair removal, skin
Yeah.
rejuvenation,
Yeah.
vascularity, all of those sort
Yeah.
of things. So I just decided that I'd learn it. And the only way to learn at that stage was getting someone that would teach you, and then going to every single training you could that was put on by the aesthetic companies, that was put on, by the farmers. And I did. And I asked questions, and I went to every conference, and I would pick people's brains, and I practiced, and I would watch things online, and it just went from there. And then I started training other people, and then I worked for Galderma and within my own clinic, and I'm lucky because I've never been someone that's over-injected people. I've never liked that aesthetic of big cheeks, big lips, frozen heads, that sort of thing. So I'm very grateful that I did follow my gut, because now we realise that a lot of things in the aesthetic space aren't what we thought they were.
Well, yeah, talk to us about that. It's an interesting space from an outsider, I guess, looking in. And, I was watching a film recently of, Death Becomes Her, of where they were drinking the magic potion to de-age. And, it's an 80s film or something. And I was like, that's really interesting.
I think
kind
no
of
one's
where
allowed to age.
Yeah, where we're at now.
Anymore. And, more power to those women that go and have facelifts and want to do that. And, I work in this space. I refer people onto different plastic surgeons. I've had a lip lift done. I've had my eyelids done. I, occasionally put a bit of anti-wrinkle in my face. I don't have any fillers in my face, but I do have biostimulator because I like that more natural look. But the number of people in Hollywood, for example, I just was watching Brooke Shields, and she's not having a facelift, and the number of women that were bagging her online because she's aged. Well, she looks her age. She looks 70. I think she actually looks fantastic for 70.
Yeah.
But then they put up the women that were making the comments about her, and none of them were wallflowers, let me tell you. They were, women that looked like they had aged not well.
Yeah.
Why
do
are
we
we
do it to
shaming each other?
Yeah.
If someone wants to have a facelift, you go for
and do
gold.
it.
I love
That
it.
makes
You're
you
going to look
feel good.
fantastic. More power to you. If you don't want one, fantastic. More power to you. everybody's choice, and it's really personal. It's really personal if someone has anti-wrinkle or not. It's really personal if someone wants their lips done. Do I like the aesthetic of these huge lips? No, I hate it. I hate it.
And it's interesting because it's getting younger and younger.
That's
like
where
we
I
were
was gonna
saying,
go.
celebrity. It's only like 5 years ago that it was sort of still a little bit to do anti-wrinkle, but then now there's 20-year-olds that are getting preventative Botox,
or really changing the look of their face. Like it used to be to de-age you a little bit, or maybe to slow down the aging, whereas now it's really young people who are going for a totally different look.
They don't come to my clinic because I won't do it.
Yeah. I mean, what are your
do you
thoughts?
say no?
I say no a lot.
Okay.
A lot.
How does that work?
But they will go to other clinics.
Yeah.
And you can tell certain aesthetics from certain clinics. With 100%. It's like the Kardashians. They all look the same.
They do.
You can tell they all go to the same dermatologist or plastic surgeon or whatever, but they all look the same. They've all got the same aesthetic. And I don't like that because you're you.
Yeah.
So don't you just want to enhance a little bit? See, I always say skin first.
Yes.
Get your skin looking good. You know, look at those British actresses like Judi Dench and those guys. They still have the lines on their face. They haven't had a face full of filler. They haven't had a facelift.
Yeah.
But their skin is beautiful. And anyone with beautiful, flawless, clear skin is always going to look fantastic with a few lines on their face. It's like I hate treating around people's eyes. So many people smile with their eyes. Why would you want to stop that?
Yeah. You know, when you mentioned about your mum had bought you your Yardley cosmetics, and my mum at 12 had me with Clinique and
Yeah, we were
dramatically
talking about
different and all of that. What would you say now to a teenager and the best tips to give themselves really great skin?
Wear sunscreen, wear a hat. Pimples are a normal part of life.
What do you do with the pimple?
Leave it alone. However, in saying that, no kid's going to go to school with a big pustule on their face, are they? So if I've got, and I treat a lot of acne in my clinic, I get them onto As Clear, which is Ego, which is an Australian brand. It's got a high level of azelaic acid, which is wonderful for acne. They've got a wash, I say keep the wash in the shower, wash your face morning and night. They've got a treatment serum which will dry out a pimple. And then they've got a moisturiser that you use for the day that's got an SPF 40 or 50 in it. I love it. It's brilliant.
Yeah.
And let me tell you, it's not expensive. Most people don't need to spend a fortune on skincare. Just go to the chemist and get some of those really great products and start just cleansing your face. I mean, half the boys that come in haven't even cleansed their face.
Yeah.
It's good for parents to know, isn't it, that they can come to someone like yourself for their teenager for help, because I think some people might only think that clinics are for injectables or for, I think that's a really, what are the really popular things that you see in your clinic for just enhancing your skin or helping with any of those skin problems? What are the really popular treatments perhaps?
Probably first and foremost is if someone comes in with acne, they come in, they have an assessment, and there are some, especially if they're blocked comedomes, so blocked pores, and you've got to get that product out. So probably a steam and extract. Peels, we love peels. Peels are just totally underrated, especially when it comes to cellular turnover, keeping your skin nice and fresh, evening the skin tone and texture, just fantastic. Really popular at the moment is Soft Wave, but that's more for that aging skin, and it's ultrasound, so it's more about lifting. There's only 3 of us in Brizzy that have that device. We're all a bit obsessed with it.
Yeah, that sounds like something we need to look into.
Yeah, it's really good. It's not cheap though, because it's all, we've got to buy shots and things all in USD, and so it's not a cheap treatment, but it's a one-off treatment. And people
just
like
one.
that. People don't have time for
multiple visits.
That's right.
Yeah.
And I say to most people, if you've got good skincare, every 4 to 6 weeks, come and have something. If it's every, quarter, that's better than nothing.
Yeah.
The one I probably love the most out of everything is IPL for skin rejuvenation, to get rid of pigmentation, to get rid of vascularity, redness. It's really great for rosacea. It's just this old workhorse that I've had for the last 20 years.
Yeah, not new technology.
It's not new.
It went out of
Yeah.
favour. It's coming back into favour. But, oh, my God, it it's so good for your skin. It brightens it, it evens the tone, it shuts down the pore size. It's just sometimes the old tried and true is pretty good.
Because there's a load of crazy stuff coming. Like there's
My friend the other day was
sperm facials and
Yeah, they're out already.
That's out already. And there was the vampire facials
Yeah.
at one point. And then what was your friend saying?
No, she was talking, I think, about the salmon sperm. But what's the
Sheep
craziest,
placenta treatment,
wildest
yeah,
things coming to market?
So that's the exosomes that had come from the stem cells. My concern with that is that, yes, we know it works anecdotally. That's it.
Yeah.
Because our clients come back and say it works. It hurts like there's no tomorrow injecting
Oh, really?
salmon sperm into your face.
Wow, yeah.
It really does hurt, but your skin does look beautiful. But none of these treatments are actually evidence-based. There's no robust research around any of it. It's just anecdotal, like you
How
said.
does that happen?
The good marketing. It's coming from Korea. It's great marketing.
Has that been, because there's been some major changes in the regulation of the cosmetics industry. What are those changes? And does it incorporate things like that with this anecdotal?
So they're actually not big changes.
Right.
That legislation has been there for quite a while. It's just that it's been revisited by Queensland Health. And
what are those changes? And is it just
it's all about
Queensland
storage
specific?
of drugs.
Right.
It's already in Tasmania.
Okay.
It's and they're trying to change things here. It's about a nurse practitioner or a doctor are the only ones that are allowed to store S4 drugs.
Yeah.
Where does that leave nurse-led clinics and...
So they're scrambling, and it depends on who their overseeing scripting body is, whether it's like Duvet or Fresh, or there's a few other ones out there. So whether that means that they are working in conjunction with a nurse practitioner who has to go into clinic and they're the ones that purchase the product and it's actually stored under their name.
Yeah.
Or it's you go and see a clinic and the product gets sent to a pharmacy. Now, I see huge issues with that in that patients are going to pick up those products from the pharmacy and they're going to go, oh, I can do this.
Yeah.
my
And go
100%.
online and inject themselves. Now, and I know that goes on. They can pretend it doesn't, but it goes on because someone who I'm friends with was saying that a guy she works with does it.
Oh
Gets
my
it from
gosh.
overseas, gets the Botox from overseas and injects himself. Now, the problem with that is recently in the UK, because anyone can inject in the UK, they're trying to change those rules.
Yeah.
A beauty clinic, a beautician, beauty therapist, bought Botox online from China and they all got botulinum poisoning.
Well, yeah. And when you say they're doing it themselves, is this a nurse who knows what they're doing?
No,
doing it
they're
themselves?
going onto YouTube.
Just like
Watching it on YouTube.
Watching it on
gosh.
YouTube.
A tutorial
That's
and then
frightening.
following.
I have seen a woman on YouTube trying to teach, who has no idea, teaching people how to inject themselves with fillers.
That's frightening with the next generation, isn't it?
Horrific.
Of social media and I mean, you know, we've got young children, young girls. That's terrifying.
That just blows my mind. So is there more regulation that's needed? Like it sounds like the ones you said around the storage of drugs. Are there bigger problems out there that need to be addressed?
I think there are bigger problems out there that need to be addressed because in my experience, and look, these are the nurses I deal with because, you know, you find your tribe and you tend to go with like-minded people. They are great injectors, amazing injectors, and they know their scope of practice. They don't work outside their scope. They will refer advanced, complex areas to me or to other colleagues that, have done the study and do that sort of injecting. I help a lot of my colleagues with vascular occlusions, with adverse events. I'll often get a phone call, get them in, I assess them, I look after them. And moving forward, I'll always send them back to their clinic. I'm not someone that'll try and poach patients. But I'll help my colleagues, and I have, and I do. And I've also helped my medical colleagues who have struggled with concerns.
Yeah.
Because I do a lot of it. I have ultrasound. I help a lot of my colleagues. I like doing the complex treatments, and I like helping my colleagues out if there's a concern. I like it, you know. So I do that, and then I have a fantastic network around me of plastic surgeons, cosmetic physicians, and dermatologists. That if I'm stuck, I can they're on my fast dial, and those guys I never hesitate to call them, and they will always pick up and help. And there's a lot of people out there, even a lot of GPs and that don't have the network I have.
Yeah.
Or want to be able to solve it themselves. And
well, that then comes into, see, I have a real issue with GPs thinking that they can, just because they're doctors, they can inject one day a week.
Which a lot are.
A lot are.
Yeah.
And in fact, someone I know, it's a client of mine, said to me last week that a doctor had come into her. She has a little salon of some description, and a doctor came into her space, wanting to buy it. And then she said, oh, no, let's just go 50-50. And then her comment to her was, oh, these changes are so fantastic because the nurses soon won't be able to inject and there'll be more money for the doctors.
Yeah. Yeah.
And that is the mindset that's out there, rather than there are a lot of people that have spent a lot of money doing up businesses, paying rent, having to, lease places, lawyers. Like, it's not cheap to run a clinic. It's very expensive.
What's the... Oh, sorry. I'm just going to go separate. What's the biggest myth that you hear in the cosmetics industry? Because, people go, oh, you put filler in, it's going to end up all over your face. There's lots of crazy things that might be the case. But what are some of those myths that you hear?
If filler is placed inappropriately, yes, it can migrate. If too much filler is placed inappropriately, it can migrate. However, we now know that in areas like around the mouth and around the eye, that yes, the majority of the filler will, be absorbed, dissipate, go. However, what remains gets agitated by blinking, by moving our mouth, by talking. And we now know that the cells that are left, or the molecules of that filler that are left behind, they expand dramatically, like 3,000 to 4,000 times its original size. Now, you've got to remember its original size is small. However, it will get bigger and bigger, and then it can migrate and move. Now, I do have a colleague that has never had filler in this area and had to have a skin cancer taken off her nose, and in the biopsy there was filler. So, yes, I do think it to some degree can migrate. I've got a couple of clients that have gone and had MRIs, and they had their cheeks done, dare I say it, very inappropriately and in the wrong plane, and then they had migration of filler all up under their eyes.
And can you see that?
Oh, absolutely, you can see it.
Yeah.
I can see it on my ultrasound, but you can see it also on the MRI.
Yeah.
And we've dissolved that because she's having eye surgery. So
what do people do? If people are looking for a good clinician and they want things done in an appropriate way, it's a saturated market. Yeah. How do you know where to go if you're a parent with children and you want to find a safe space for them to actually look after skin, or if you want to enhance yourself? Like, how do people know where to start?
I think you need to look at the clinic, look at the protocols around that clinic. Are they doing the right thing? Look at that. The best thing to do is look at their Instagram.
Yeah, because how does a consumer know what the right thing is?
Because if they're not following the law, if they're not following the TGA rules, and they've got before and afters and a whole heap of stuff on their Instagram, or they're showing that they're
then people won't
injecting,
even know that that's not allowed.
then
so you've got to do your research.
You've got to do your research.
But they should look for the before and after photos are no longer allowed.
No.
Yeah.
And you're not allowed to use the words injecting, any toxin like Botox or Dysport or those sort of words. There's just so much you can't say or do. So I think anyone worth a pinch of salt has removed all of that. And yet in my podcast, I interviewed the guys from Operation Redress, and they're very big advocates for this space for the consumer. And they are doing up an AI app that will just go through and have a look at websites, look at social media, and it flags how many errors you have or things you haven't changed. He said, Michael said to me, do you mind if I have a look at your website? Now, I had gone through everything.
Yeah.
I still had 36 mistakes on my website because in the back end.
Yeah.
And I didn't even know about the back end.
The back end.
there's
I was going to
stuff
say,
that
like
you
looking
don't
at the
even-
outward facing.
Yeah.
Had no idea. So then we had to get in touch with our webmaster and get him to take that off because he'd still left that on for the SEO.
Yes. Yeah.
I had no idea. I was like going, no, I've removed everything. And he's going, well, you've got 36. He said most people have thousands.
Yeah.
Wow.
I've got so many questions.
Sorry.
No, you go.
No, mine was off, so go.
Okay. So, Beck, what are you most proud of in all the things that you've done and where you are today?
My family, my 2 kids and my husband. So they've turned out to be really good people. And don't know why. I don't know what I did.
have you done? What have you done? Tell us.
Because
Because we're all really
hopeful,
young.
right? Yeah.
They're both the kids were involved in high-level sport, so that kept them busy. I also wasn't one of those parents that the kids had to get all A's, all that sort of stuff. As long as I saw A for effort, I was I was fine. They weren't allowed to sleep with their phones. They weren't allowed to take their phones into their rooms because social media and all that was just starting to
Take off.
And there was a bit of, there was pushback with that. And I just said to the kids, that's fine. You pay for your own phones. You can keep them in your rooms. But while I'm paying for them, they're mine to do with as I please. So, that was really good. My husband is divine and very supportive. We did have a marriage breakdown for about 6 months, and
Did that coincide with your burnout period? Yeah.
and I just stopped drinking, and it was there was so much was going on, but he was just amazing, and it wasn't because of other people or anything like that. It was just I was really unhappy.
Yeah.
And how can you give to someone else when you're trying so hard
Yeah,
to
and Chloe had
help
gone
yourself?
away, and Jake was finishing up. I'd finished my nurse practitioner, so I just was lost.
Yeah, talk to us about that because you mentioned earlier about you've given up alcohol and that's a journey so many people are exploring at the minute and they're talking about it, but I feel like it's so hard for people to actually give up because our culture is let's go for a drink, let's go for knockoff drinks. We go to restaurants and now everything is paired with wines, and even though there's some great non-alcoholic options, it seems tough. So what was the prompter for you and how's that journey been?
The journey is easier now, but it was very hard in the first instance. I knew it was becoming problematic, and I went and saw a GP and was shamed by her. And I remember going out and sitting in the car and ringing a friend of mine whose husband's a psychiatrist, and I said to her, would he see me? And I knew that would be the end of that friendship because, I had to be very respectful of the fact that he would now be my clinician. He got me in within a couple of days and started me on a medication called Campril. But I don't know if it was the medication or I'd made that decision and then also had that support that literally I never had a drink again, and I haven't. Now it'll be 6 years, beginning of next year. So I think support makes a big difference.
Yeah.
I also, I had tried AA. I hated it. I just couldn't stand not touching anybody, and someone would be telling their story and really distressed, and the rules are you can't touch anyone because you don't know what sort of trauma they've had. So I joined a group called Smart Recovery Australia, and I could do it online and I could be anonymous, and I realised going on to that I was really lucky. And I think if I had have kept on the trajectory that I was on, I would have been in the situation some of those people were in, being court ordered or drink driving or something like that. But it really opened my eyes up to the struggle people are having with the ability to get alcohol with no stop in between. You know, during COVID, you know, it was classed as an essential service.
Yeah.
I mean
that's
seriously,
crazy,
I just
like,
have
when
to
you
say
think
it,
about
what
that.
the fuck?
Yeah, like
And domestic violence went through the roof during COVID. Alcohol sales went through the roof. And there were women on there that had kids at school and would just call up and it'd be delivered straight away to them.
And working from home and, you know.
Huge issues. And, you know, people go, oh, well, why aren't you strong enough? Or it's not that. It's very insidious drinking. And you feel like you can cope and you're doing okay until you can't. It's like gambling, you know? And our culture is that if you don't drink, there's something wrong with you. And I have been told that.
Yeah, have you found that difficult? Like, have you lost friends? Have
Yep.
you have found it difficult going to functions? Or
At first I did. I don't now. But, you know, just this weekend I struggled going to an event because everyone was drinking, everyone was pairing wine with food, and I had to keep asking for my drink to get filled up with sparkling water, you know, and it was in a tumbler, whereas, you know, they could have said, oh, let's get you a wine
nice
glass.
wine glass.
And put some sparkling water in that for you, you know, perfect. I love now that there's a lot of places that do great mocktails or, see, the States do it really well. There's usually a whole page of mocktail, or they call them virgin cocktails.
Yeah.
And just not drinking is the norm over there. People, if you don't drink, it's no big deal. You don't drink here. Like I had some person tell me once that, you know, he doesn't trust anyone that doesn't drink. I've had another guy, we were at a Melbourne Cup function and offered to buy, he sort of worked with this group that, you know, his exact words were, oh, God, aren't you fucking boring?
Oh, wow.
And I left fairly quickly
bet,
after that. Or when I go into events, and I just found this recently, I went into an event and all they had was wine, champagne and beer at the front entrance. Like,
Yeah.
It's not okay.
it's not okay anymore. You've got to be able, people have got to cater for people that are non-drinkers because that younger generation are not drinking.
They're
That's
not
what
at
I was
all.
going to say. We notice here, you know, the younger people coming through, it's just a choice they're making.
It's such a great choice because as we go into menopause and perimenopause, what
Yeah.
alcohol does to our bodies as women in particular is horrendous. And the more you drink, they now know it's linked to Alzheimer's, it's linked to dementia, it's linked to poor bone health. Anxiety is a huge thing for menopausal women. And it exacerbates all of that, you know.
It's disappointing to hear that you felt shamed by the GP when you tried to get help.
Yeah.
And talking earlier about people bringing people down within the healthcare sector and not supporting success and just not supporting each other. What do you think has to shift to really create that happier healthcare workforce in this country? What is one thing that we could do?
Support each other. Education is paramount. Education around self-care is paramount. It's okay to say no. I recently had significant back issues and I had to, and most people wouldn't even know about this, I ended up having to find my own specialist because my original GP, didn't believe that I was having falls because of the major issues with my back. I had a bit of foot drop. I'd been to a pain specialist and she told me I was making it up and drug seeking. Went to emergency at St Andrews because after the cyclone here, I moved some things and my back was really bad. Went in asking for an MRI and he just treated me horrifically. And it was at that point I then reached out to colleagues and said to them, you know, who do I see? And, you know, I was able to get in and see them. But most people don't have those contacts.
Yeah.
So if I got treated that way as a health professional, what hope do the general public have? Or are the nurses that don't know or haven't been around for as long as I have been? I mean, and you hear this all the time, this gaslighting around medicine. I don't know what the answer is. I think we need to support our young people. We need to encourage them to stay. We need to let them know that, no, nursing isn't glamorous. However, there are some amazing job opportunities in nursing. There's so many different pathways you can take.
If one thing isn't for you, there still might be something within nursing that is. Yeah.
Do they talk about, though, like, how do you define self-care for healthcare professionals when they're doing shift work, they're doing back-to-back? Is there a piece where we actually need to define it?
I think that limiting the number of patients you're looking after, having good patient-nurse ratios on wards is very important. If a nurse can't work or stay back and she says no, respect that. You know, usually there's a pretty good reason why someone can't stay back. Don't keep going to the same people that always say yes, because you'll end up burning them out. We need to make sure that they're, you know, that as colleagues, if you notice in someone that someone's getting burnt out, they've maybe made a couple of mistakes, they're coming to work a bit dusty, you know, instead of turning into this big drama, take them aside and have a chat with them.
Are you okay?
Are you okay? Straight away, you flagged with them that someone's watching them, that they know something's amiss. So, and then if someone does tell you something, keep it a confidence. You know, unless it's a mandatory notification. But, and if you're a leader and someone talks to you, I've heard so many horror stories about nurses going into their leaders to talk about things, and then that person has gone out and spoken about it with other people. That's a no-no.
So then that brings fear of not speaking up.
And they won't.
Yeah.
We have to support each other, you know, hold someone's space with them if they need you to. Ask them if they want help. That's a big thing. Ask. Are you okay? How can I help you? Do you want help? They might say no.
Yeah.
They might be going through a marriage breakup. Their kid might be unwell. Their dog could be sick for the day. Like, unless you ask, you will never know. So look after your colleagues, you know, be collegial. Doctors actually do this very well. Nurses not so much. Do
you think it's because it's a largely female profession?
I think yes, but I also think historically nurses have been notoriously awful to each other. And I have seen it time and time and time again. When I was in the hospital, when I was in the theatres, I mean, I learnt very early on in the operating theatres to be friends with everybody. Just lay low, just be friends. And I've done that in the aesthetic space. I've just kept to myself.
It's interesting, isn't it, when you're in this caring profession of caring for others, but not caring for one another. It sort of doesn't make sense.
The best wards I ever worked in had amazing leaders. And I can tell you off the bat, when I trained, it was C3, I'm sure it was CC3 or CC4, which was diabetes. And I think her name was Beth. And she was standing in as CNC. She was amazing. And I loved her. And then the other one was M6, which was infectious diseases. And the ward was run by a registered nurse called Dolly.
What made those two so special?
They cared. They cared about their staff and they cared about their patients. And they took the time to explain things. So I had and I've spoken about this on my podcast, where a daughter was just being a real cow to me. And I was very young, very stupid nurse, you know, very naive. I was, 17 at the time, 16, 17. And I found her really rude and awful to me, and I was just doing the best I could. And I can remember walking out of that ward or that room, and the CNC was there, and I remember saying to her, I just can't make this woman happy. I just don't know what I'm doing wrong. And this woman came out, probably to complain about me, I don't know. And I remember she walked down and opened her arms up to that woman, and that woman laid her head on her shoulder and cried. That's all she needed.
Yeah, she was under stress.
She was under stress. She didn't need a 17-year-old trying to tell her what to do. I had no life skills.
Yeah.
But my CNC did, and I had enough insight to watch that interaction to go, okay, I was way over my head here. I was trying to be something I wasn't. And I learnt a lot from that one interaction because she was such a remarkable leader, remarkable human, you know. She could read patients and families and it's funny, the little interactions like that I learnt a lot. Dolly, big on education, never treated anyone like a fool. If you didn't know, she'd go, okay, let's get you some education in that area. But she was strict. She was strict, and we all had guidelines and we knew what our rules were, and you just didn't break them because you didn't want to let her down.
Yeah.
But then unclear is unkind. To know where you stand and to know what you have to do and have clarity around your role makes everyone perform better.
Oh, they were two leaders that really stood out for me, and yet my first ward at PA, oh my God, I just have the worst memories and nightmares because the CNC was awful to us all. The RNs didn't want to be there. They were awful to all of us. Out of all the new students, there was 2 of us that went on to do nursing.
Wow.
Everyone else left after 6 weeks.
Like this sink or swim.
Absolutely. So when you think about nursing that way, I mean, yeah, it was a hard... I think university is a wonderful way. Do I think it could be better? Absolutely. But I don't think anyone should be my age where I was 16, just turning 17 and laying out bodies, cleaning old men up. I look back now and no wonder so many nurses left. There's just this huge attrition rate.
Yes.
Doing it through the hospitals that you don't hear about, but it happened.
Yeah.
Thank you, Beck. CMR are making a donation to a charity of your choice with this episode. Where are we donating that money to?
I'd like that to go to FAIR. Well, I think it's FAIR Australia,
Yes.
Which is all around alcohol research, fetal alcohol syndrome research, stopping or research around cessation of advertising and the ability to get alcohol so quickly. So, it's close to my heart. I think it's a wonderful organisation.
Yeah, absolutely.
Thank you so much, Beck. It's
You're
been
welcome.
an absolute pleasure to have you here today, and we've covered a lot of topics. We got all over.
Yeah.
But we're so grateful for our time with you today.
You are more than welcome, and thank you so much for asking me. It's been a delight to be on the other side of the microphone.
We care for the land.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.